Hello everyone, welcome to sqadia.com. My name is Osama and we are talking about hemodynamic dysfunction. In this part of the lecture, we are going to talk about edema and shock. So we're going to talk about the edema, shock, and types of both edema and shock. So let's start off with edema. What is edema? Edema is actually the abnormal accumulation of fluid in interstitial spaces or body cavities, which means the fluid comes out of the blood vessels either in the form of the transudate or exudate, and it lodges in the interstitial spaces, which results in the swelling of that body part. The causes include increased hydrostatic pressure, such as in congestive heart failure. For example, if there is a right-sided heart failure, then there would be peripheral edema, because in right-sided heart failure, the blood from the systemic circulation has to be pumped into the pulmonary circulation. So if there is a right-sided heart failure, the blood remains in the peripheral circulation, and then because of the stasis, it starts to move out of the blood vessels and results in edema. On the other hand, in the left-sided failure, the heart is not able to push the blood into systemic circulation or the peripheral circulation, and that results in the accumulation or of the blood in the pulmonary system, and that results in the movement of the fluid from the blood vessels into the area, causing pulmonary edema. The second is the increased capillary permeability, which can be either because of the inflammation of the capillaries, such as vasculitis or burn injuries which may involve the capillary endothelium as well. Other include a decreased oncotic pressure because of the decreased protein quantity or decreased albumin in the decreased albumin serum levels, which is also known as hypoalbuminemia, and it can either be because of the increased loss of the albumin in the nephrotic syndrome, or either because of the decreased production in liver cirrhosis. Edema can also result from increased sodium retention, such as in primary sodium retention, which is because of the activation of the renin-angiotensin system, and the sodium retention occurs as well as water retention occurs in response to the activation of the aldosterone via the renin-angiotensin system. And secondary, in which there is an underlying condition or disease, for example, a congestive heart failure, in which the decreased cardiac output and renal blood flow activating the renin-angiotensin system and aldosterone, thus stimulating the sodium and water retention. And once again, the blockage of lymphatics can also result in edema, which is also known as lymphedema. Different types of edema include anascara, which is actually the generalized edema of the body; hydrothorax, in which the edema is in the pleural cavity. So as you can see here in this X-ray, that in this part of the pleural cavity, you can see that there is accumulation of the fluid. This fluid can also accumulate in the pericardial cavity, which is known as hydropericardium, and here you can see the fluid accumulation in the pericardial sac, and hydroperitoneum, which is also known as ascites, in which there is a fluid accumulation in the peritoneal cavity. Now, the edema is of two types based on the type of the fluid that comes out of the blood vessels into the interstitial spaces. It can either be transudate or it can be either exudate. So transudate and exudate are actually different based on their composition. In transudate, there is actually altered intravascular hydrostatic and osmotic pressure. So hydrostatic pressure, increase in the hydrostatic pressure, either because of venous outflow obstruction or congestive heart failure, would actually result in increased tendency of the fluid to move out from the blood vessel. And secondly, decrease in the colloid osmotic pressure, either because of the hypoalbuminemia or decreased protein synthesis, for example, in liver cirrhosis, or in kidney disease, in which there is increased loss of protein. So These conditions actually result in decreased colloid osmotic pressure and thus decreased tendency of the fluid to retain within the blood vessels. So these conditions actually result in edema, and that type of fluid is actually non-inflammatory and it has low protein content, and it is known as transudate, and the specific gravity for transudate is less than 1.012. On the other hand, exudate is in response to any inflammatory process, and there is an increased vascular permeability in response to inflammation, and thus there is vasodilation and stasis and fluid and protein leakage, as well as migration of the cells as well. So there is a high protein content in an exudate, as well as inflammatory leukocytes which have migrated from the blood vessels into the intracellular spaces, and there would be a markedly decreased glucose content in the exudate, because those inflammatory leukocytes consume glucose for their processing, and the specific gravity for exudate is greater than 1.020. Now, shock. What is shock? Shock is actually circulatory collapse with resultant hypoperfusion and decreased oxygenation of the tissues because of decreased blood supply or impaired blood supply to the tissues. What are the different causes? The causes are either the decreased cardiac output because of hemorrhage or left ventricular failure, or it can either be because of widespread peripheral vasodilation, such as in sepsis, which means a generalized infection, a severe trauma resulting in hemorrhage, resulting in blood loss outside of the body, and even with hypotension. So different types of shock include, first of all, hypovolemic shock. As the name indicates, it decreased volume of the blood. So acute reduction in blood volume, either resulting from severe hemorrhage or loss of fluid from skin from burns, or either any type of physical trauma. So loss of fluid from gastrointestinal tract can also result in hypovolemic shock because of conditions such as excessive diarrhea or vomiting, and that results in acute reduction in blood volume and thus hypovolemic shock and impaired blood circulation. Shock can also be cardiogenic shock, in which it is because of left ventricular failure or myocardial infarction, as we already discussed in the previous slide. It can also be generalized sepsis or septic shock, which is characteristically associated with gram-negative bacteria, but it may also occur with gram-positive bacteria as well. On the other hand, there's also neurogenic shock, which is associated with severe trauma and reactive peripheral vasodilation, resulting in very significant decrease in blood pressure and resultant shock. Now, whatsoever is the type of the shock, there are three stages for the shock. There is the non-progressive stage, the progressive stage, and the irreversible stage. The non-progressive stage has the best prognosis because the compensatory mechanism like heart rate and peripheral resistance maintain perfusion of vital organs by maintaining the perfusion of the tissues and the blood pressure. Then comes the progressive stages of the shock. If we do not give the medical intervention, it results in hypoperfusion and onset of circulatory and metabolic imbalance, specifically metabolic acidosis because of lactic acid accumulation resulting in lactic acidemia. Compensatory mechanisms thus are no longer adequate or sufficient, so medical management is required. And even if this stage, if medical intervention is not given or medical intervention is not there, then it progresses to irreversible stage, in which there is irreversible organ damage, severe metabolic disturbance which cannot be reversed, and survival for that individual is not possible. That eventually leads to death of the individual. Now, what are the morphological manifestations of shock? First of all, and most important, is the acute tubular necrosis of the kidney, which is potentially reversible with appropriate medical management. Others include areas of necrosis in the brain, which is not reversible, centrilobular necrosis of liver, fatty changes in heart and liver, patchy mucosal hemorrhages in the colon, depletion of lipid in adrenal cortex, and pulmonary edema because of left ventricular failure. So that was all about edema and shock and types of edema and shock. I hope you learned a few things out of it. So keep on watching sqadia.com for more lectures like this. Thank you very much.